I want to be super clear about who is talking to you right now. I am not a doctor. I am not a nurse. I am not a member in any way of the healthcare workforce that I love so dearly. I am an actor. I'm the son of a nurse who spent 50 years caring for other people, and I've spent decades trying to do justice to what she and the rest of you actually do. That is the only credential I am claiming today. Most of you know that I've been part of 2 shows about emergency medicine. ER when I was younger, and a lot less wise, and now the Pitt. The Pitt is what happened when a group of us got obsessed with one question. What does the job actually look like right now? And to answer that question, honestly, we listened. We listened to emergency physicians, we listened to charge nurses, we listened to residents being asked to function on 3 hours sleep after working 18-hour shifts and then being asked to head right back in. We listened to social workers, to techs, to attendings, to chaplains. And we did not have to go very far. The reality was right there. You were all living it every day. And what I learned from this show and what is now in my bones is that medicine is hard enough, but so much of the damage is coming from everything around medicine. It is the prior auth that takes the surgery off the schedule. It is the staffing ratio that turns a manageable shift into a moral injury. It is the tuition bill from a decade ago that still dictates where you can live and what you can afford. It is the fear of telling the truth that could cost you your job. And I'm not telling you anything that you don't already know. You came to the Capitol today because you are tired of the gap between how this country talks about healthcare professionals and what the reality is. And you came because clapping is not enough. Let me say plainly what we're asking Congress to do. 1, pass the Healthcare as Human Act. A federal tax credit of up to $6,000 a year for healthcare professionals serving the communities that need them the most. And let me put that into a little bit of context. The U.S. tax code has tax credits that encourage all sorts of things, like restoring historic buildings and maintaining railroad tracks, creating wells for oil and gas production, semiconductor manufacturing, even keeping distilled spirits in warehouses. And I'm not weighing in on any of those. But if the tax code can value all of that, supporting the people who keep us alive should not be the harder call. This is not a luxury. If healthcare professionals aren't paid fairly, they leave the profession and patients get sick and die, full stop. 2, fully fund the programs of the Dr. Lorna Breen Act. Before I say another word about funding, I just want to say her name one more time. Dr. Lorna Breen. Dr. Lorna Breen was an emergency physician. She spent her life taking care of people on some of the worst days of their lives, and during the early days of COVID, she did what healthcare professionals do. She went toward the crisis. And then she needed support in a system that still makes too many people afraid of what asking for help could cost them. I never met Dr. Breen, but I know her story because her family refused to let her death be defined by suicide. They turned her grief into action. They helped change a federal law, and because of them, more healthcare professionals are able to get the support before they reach a breaking point. That is legacy.